Aimed at reforming the National Health Service, NHS, the UK government has announced plans to abolish NHS England, the administrative body responsible for overseeing the health service in England. This decision, spearheaded by Prime Minister Sir Keir Starmer, is part of a broader effort to streamline healthcare management, reduce bureaucracy, and bring the NHS under more direct democratic control. The abolition is intended to enhance efficiency, cut costs, and redirect resources towards frontline services. But what does this mean for patients, and how will it impact the future of healthcare in England? NHS England was established in 2013 as an arm's-length body following the Health and Social Care Act of 2012. Its primary role was to allocate funds, set priorities, and manage health services across England, with a focus on reducing waiting times and improving health outcomes. However, critics argue that this structure has led to unnecessary duplication of efforts with the Department of Health and Social Care, DHSC, resulting in bureaucratic inefficiencies. The government's decision to abolish NHS England is driven by several key factors. By integrating NHS England's functions into the DHSC, the government aims to eliminate redundant administrative roles and streamline decision-making processes. This is expected to save around £500 million annually, which can be redirected to patient care. The move is also intended to bring the NHS under more direct democratic oversight, allowing elected officials to have greater control over healthcare policies and spending. While the specifics are still evolving, there is an expectation that some responsibilities will be decentralized to local health authorities, potentially allowing for more tailored services that better meet community needs. The abolition of NHS England is not expected to directly affect patients' access to NHS services, as the NHS will continue to provide care free at the point of use. However, the long-term impact on service quality and efficiency remains to be seen. Key considerations include: the government hopes that by reducing bureaucracy, more resources can be focused on reducing waiting times and improving access to care. However, critics argue that structural changes may initially disrupt services. While the NHS is set for a funding increase, the specifics of how resources will be allocated post-abolition are unclear. The potential savings from abolishing NHS England could be significant, but ensuring these translate into better patient outcomes is crucial. Decentralizing decision-making could lead to more responsive healthcare services tailored to local needs, potentially improving patient experiences. The transition process, expected to take 2 years, will involve significant changes, including a reduction in administrative staff by approximately 50% across NHS England and the DHSC. This period may see disruptions as staff adjust to new roles or face redundancy. The government must ensure that these changes do not compromise service quality or staff morale, which are critical to delivering effective healthcare. The abolition of NHS England represents a significant shift in how the NHS is managed, with potential benefits in efficiency and resource allocation. However, the success of this reform will depend on how effectively the government navigates the transition and ensures that the changes ultimately benefit patients and healthcare staff alike.